really struggled. And I struggled with, how am I going to control myself and not give you a blood bank commercial? So I promise, I'm not going to give you a blood bank, blood donation commercial.
Oh, go for it.
But, don't forget, if you got a free moment, go out and donate. So seriously, I'd like to start by introducing our head table today. And at the head table, hopefully there's a nice representation of who we are as community-focused organizations and folks. And I'll start off with President Kai, Dave Fleming, who is substituting for Secretary Cindy today. And Dave, you all know, is from Delaware Community Foundation. We've got Yasa Payne from the University of Delaware, who's representing kind of the higher education world. John Matarisi from WSFS, who's a newer member to the club representing the business world, who also has a very keen interest in healthcare. Michael Waite, who's our blood bank director for marketing and public relations. And he was going to make me do the commercial, by the way. I couldn't get away with it without him being here. And most importantly, our two guest speakers, Peggy Geisler and Julane Armbrister from the Delaware Center for Health Innovation. The Delaware Center for Health Innovation is a nonprofit organization whose purpose is to guide implementation of the state's healthcare innovation plan. And you'll get to hear from actually both of our speakers today, starting with Peggy Geisler. Peggy's the owner and senior consultant for PMG Consulting and is the project director for the Delaware Centers for Health Innovation's Healthy Neighborhoods program. This program supports initiatives designed to address social determinants of health and to accelerate integration of Delaware's care delivery system into communities to improve population health. Peggy has an extensive community-based nonprofit set of experiences, including currently serving as the chair for the fundraising efforts on behalf of the Partners for Pause. She's currently co-chair of Delaware Excel and also serving on Reinventing Delaware's SVE committee. She can tell you about that if she'd like. The University of Delaware Cooperative Extension Family and Consumer Sciences Statewide Advisory Council. I've been practicing that line all day. She also has past board service with the Delaware Healthy Eating and Active Living organization and Delaware Governor's Council on Health Promotion. So Peggy holds a BA in clinical psychology from the University of Maryland and a master's degree in clinical psychology from Salisbury University. She's a licensed consultant for the Standards of Excellence Institute for Maryland Association of Nonprofits and the Delaware Alliance for Nonprofit Advancement. Julane, I'll use Miller. Julane Miller-Armbrister brings a rich and diverse background focusing on public health, advancing healthcare delivery systems, and improving health outcomes. She's currently the director for the Delaware Center of Health Innovation. Her prior roles include serving as the Chief Executive Officer for the Plainfield Health Center in New Jersey, which was a qualified health center that provided primary care services to more than 22,000 patients annually. She's also been a Senior Vice President for Public Affairs at the University of Medicine and Dentistry in New Jersey, Vice President for State Government Affairs at Rutgers University. She served as adjunct professor at both Rutgers and Keene universities. Julane is a graduate of Douglas College, Rutgers University, and Rutgers University Graduate School of Social Work, and is currently a doctoral candidate in the Rutgers Joint Urban Systems PhD program. And actually, she's all ready to finish her dissertation, so maybe the next time we invite her back, it'll be Dr. So, an educator, an executive administrator, and a government relations professional. Please join me in welcoming first to the podium, Julane Miller-Armbrister.
so much. It really is a pleasure to be here. I don't usually like for people to say I'm working on my doctorate. It puts too much pressure on me to finish it. It's like I just like to sort of just quietly get it done. But it really is an honor to be here. I want to say that I'm relatively new to Delaware, just a year now in July. And it really, we're just so happy that we decided to make this move. We really enjoy being here. Looking forward to become even more engaged than what I am now in being a part of Delaware. And I'm also relatively new to this position as Executive Director for the Delaware Center for Health Innovation, which I'll just shorten and say DCHI for now, going forward so that I don't have to keep saying that mouthful. But and coming here and taking on the role of Executive Director for the Delaware Center for Health Innovation, it really is a passion that I have in terms of working to make sure that everyone has access to health care. One of those people, regardless of how you want to label us, that truly believe that health care should be a right for everyone. And I am really glad to be a part of an effort that is moving toward making sure that people from all walks of life can access health care, but also be able to experience care in a different way, in a way that is very patient-centered and focused. And as I tell you a little bit more about our organization, you'll also see that we're not just focused on just the consumers of healthcare, but on all aspects of healthcare. So today, let's see which one of these doohickeys here I use. So this one, right? Great. So today, our goal, Peggy and I, is just to introduce you to the Delaware Center for Health Innovation, and I'm going to provide you with just a very high-level overview of who we are and what we do and what the transformation movement is here in Delaware. And then Peggy will describe to you one of the key initiatives that we have, which is the Healthy Neighborhoods Initiative. And now you're also going to witness firsthand here that one of my problems is being technologically challenged. So I'm going to ask someone else just to get me on the right track here with that in terms of which one I move, and then I'll go forward here. My kids are teaching me, and they've been trying to teach me for years. We're working on it. So I'll start with, Roy actually told you a little bit about who we are and what we do. But DCHI, as he indicated, is a not-for-profit organization. We're an independent public-private entity, and our mandate is to help lead the effort of healthcare transformation here within the state. And I'll give you just a little bit of background before moving forward, is that this whole effort of healthcare transformation in Delaware started a few years back. It really started with the state taking a very serious look at the overall health of Delaware and starting to put together a state health plan. And moving from that, as part of that planning effort, Delaware applied for a grant from the Center for Medicaid and Medicare for a planning grant to start to look at how can we improve healthcare across the state of Delaware, but not only just providing healthcare, but all aspects of healthcare. Delaware was one of the few states that actually received that grant, and then they went on to become one of the few states that actually received a $35 million implementation grant to be able to put that plan into effect across the entire state. Our work then, as DCHI, we were a part of the plan to make sure that there was an entity set up that was just outside of the state to help guide this work. But I think even more important, the goal is that even beyond the life of this grant, which will end in 2018, that this effort does not end with the grant, but that we continue to move forward, we continue to build upon the momentum that has been gained over these past few years and this year as we are implementing the grant and as we go forward. So the Delaware Center for Health Innovation is that entity that was created outside of the state by stakeholders, by the state, by the Delaware Health Information Network to make sure that there's continuity and sustainability of this healthcare transformation effort. So, and also, as was indicated, our primary work is to guide this effort. We are stakeholder funded, although we do and we are seeking some grants, but our work is not supported by the federal grant that was received, but is supported by the stakeholders that are invested in this effort across the state. And so we work very hard to try to drive consensus around the approach to implementing and achieving transformation at all levels. Okay, so I'm just going to, good. Okay. What do we hope to achieve with this transformation effort? And I call it a journey. So what do we hope to achieve as we embark upon this journey and as we continue it? As you can see, our aspirations are very high. Our vision is very broad. But we do envision a state where Delaware will become one of the 5 healthiest states in the United States. Currently, and does anyone know where we rank currently? I'm sorry, I heard. Yeah, well, you're getting close. Currently, we rank at number 32. So becoming one of the 5 healthiest states in the United States is a big aspiration. But that ranking is affected by a lot of things. It's affected by the fact that we have higher incidences of chronic diseases such as diabetes, infant mortality, addictions, the prevalence of social determinants that affect the health, such as poverty. And this is that we don't raise this to say that this is the fault or it is the issue for just any one entity or one group or one organization or one population here within the state, but it is a problem for all of us to grapple with. It is an issue that we think that working together and moving together, that we can all help move that needle of Delaware being number 32 toward us being one of the top 5. We're also we are aspiring that we will achieve and be one of the top, we will achieve top 10% performance for quality patient experience. Right now in the rankings nationally that is gathered, we average someplace around 3 out of 5 in terms of how patients rate their experience for healthcare in the state. And I think one of the important goals for this effort is to be able to bring healthcare spending growth more closely in line with the growth of the economy. Currently, we spend about 25% more per capita than any other state on healthcare. And again, this is not due to just any one factor. It's due to so many different factors that we could go into and spend hours on. And then we have added one to what is known nationally as the triple aim being to improve care, to improve the patient experience, to improve quality, and to reduce spending. We added the one of achieving higher provider experience here in the state. We know that we have a dearth of providers in certain areas of the state and within certain professions such as mental health and dentistry. Our goal is to be able to create an environment for recruitment and retention of providers across the state, and also just to be able to create an experience for providers where they can focus more on patient care as opposed to on the growing administrative burdens that doctors are experiencing every day with all of the changes in rules and regulations. So our plan in terms of that aspiration is that we are engaging peer participation across government peers and as well as commercial peers. All peers are engaged in this effort to try to drive new models of payment for how we receive care. And we're focusing on driving value-based payment models across all peers that focus on higher quality, controlling cost, and as well, again, as on controlling and improving the overall care and provider experience. And with that, in terms of driving how care is paid for, we're also looking at better value for what we pay for. Better value at a lower cost. Our goal is that through value-based payment models, that eventually the state will be able to realize $1 billion value in savings over the next several years. And then what should happen with all those savings? Our further goal would be that those savings are reinvested back with providers so that providers can continue to improve the way they deliver care, and that they too will become more invested in quality care, care coordination, and integration of care. And furthermore, that those savings, at least half of those savings, will be driven back into being able to make care more accessible by lowering costs for employers and for plan sponsors, and as well as for consumers such as myself and you. So who is involved in this effort? You saw earlier that we have a broad base of stakeholders. Our stakeholder participation, as we said, we're targeting all interested parties, all parties who should be engaged in this effort, who should care about this effort. And when I say should, that just includes everyone within the state. That includes healthcare agencies in Delaware, such as the Medical Society of Delaware, Visitor Nurse Association, every large payer. Right now, we're working with every payer that has contracts within the state of Delaware. It includes consumer advocacy groups such as the AARP, groups focused on disability, and all other types of community organizations and agencies. It includes the business community. That is the community that I said to one of your members earlier that we're really starting to focus and to target, because that is probably the group that we've had the least amount of involvement with, but we recognize how important that group is to helping us drive transformation and to focusing on the type of value that is received and that is delivered in healthcare. It provides extensive provider participation. Every healthcare delivery system, including the FQHCs, private independent practitioners across all disciplines, that we have been engaging in this process, and they have been actively involved in the process. This project from the very beginning had the endorsement of the governor. It continues to have the endorsement of the governor. It continues to have high-level involvement from major state agencies such as the Department of Health and Social Services, and it has the involvement and endorsement of all of the largest educational institutions here within the state. So our board is made up of volunteers from multiple entities, multiple stakeholders, and our standing committees also are volunteers and experts from across all of these dimensions of stakeholders that are involved in this process. So how do we plan to do all this? How have we been doing all this? Well, our strategy is that this will be a collective effort. It will be a multi-pronged effort. We're not just targeting just one aspect. It's not a linear process, but it is a process where we are engaging every aspect and dimension of healthcare that we think is critical to be able to move us toward transformation. That includes transforming how healthcare is paid, transforming how healthcare is delivered, transforming how we as consumers receive and engage in healthcare. And it also includes transforming how we advocate for policy changes in healthcare. So some of our strategies, some of our key strategies, as you see, and as I mentioned, involves transformation of primary care. We are currently working with providers across the state, providing support to them for 2 years through grant funding, so providers do not have to pay for it, to help them take a very close look at their practices, how they deliver care, to look at where they are feeling overburdened, to look at the challenges that they have, and to be able to help them build in efficiencies, be able to help them build in a better way of how they deliver care, and to reach certain milestones that we are equating with quality milestones in terms of how care is delivered. So practices can enroll for this. They can receive services through one of 4 vendors that are contracted with the state. And those vendors will work with those practices over 2 years in helping them to be able to transform their practices to achieve greater efficiency and to improve upon the quality of the care that is delivered. But ultimately, it is also to make sure that we're improving upon the outcomes and the consumer experience, and to be able to drive down the cost of healthcare. Currently, and you'll see a little bit later, I'll tell you a little bit about where we are in that milestone in terms of the practices that we have enrolled. But just to run through some of these very quickly is that We are also, we have establishing, and we will launch in the late fall, what we're calling a common scorecard for primary care. And that is the third bullet there toward the far left there. That common scorecard is intended to be able to bring together all of those measures that all the different peers use, all the different, some provider systems use, et cetera, so that providers have one scorecard that they're looking at in terms of how they're able to gauge and how their delivery of care is measured, how utilization is measured, how their controlling cost is measured. Again, in improving the provider experience, we recognize that everybody is evaluating them. Everybody has a scorecard. And that it's too much. It would be too much for us to have to fill out 50 million reports in our business every year in terms of what we're doing. It doesn't leave any time to make sure that care is being provided. So we have generated, it's a very innovative approach, and I believe we're one of the first in the country to come up with this multi-payer scorecard, where our experts that are part of our committees derive the scorecard. The peers have invested in it, all of the peers across the state, where they have adopted at least 75% of the 26 measures on our scorecard. And we think that's pretty phenomenal in terms of that we have that type of commonality in terms of what we're looking at that says, yes, quality of care is improving, yes, utilization is improving, yes, cost of care is improving. And in rolling this scorecard out, which the second version will be launched in late fall, we did have a version 1, and we spent all last year testing that version to make sure that it was going to have some utility for all of the users. Providers will be able to look at that scorecard whenever they want to through the website that has been set up for them, but in addition to that, we're setting it up so that we can aggregate the data from those individual scorecards so that we have state-level measures to see how we're progressing. But more importantly, we're working on consumers being able to use information from that scorecard as well, so that consumers are also better be able to think about how they engage with the providers that are necessary for their care as well. Some of the other things that we're focused on, just to go through this quickly, is care coordination funding. This is one area where we really started out gung-ho thinking that we could achieve this a couple of weeks, maybe a month, maybe a year. We're finding that it's probably going to take us maybe another year, but we're still focused on this, and we're very much hoping that we will reach a point where everyone, peers, providers, everyone will consider care coordination such a key component of how we deliver care, so that it will be something that is paid for and not something that providers have to do without being reimbursed for it. And I'm going to skip integration of community-based health initiatives because Peggy is going to give you a lot more detail about that. And I'm going to just sort of wrap up to give her a chance to come up to talk more about healthy neighborhoods. But one of the last things that I do want to do is just sort of give you a snapshot in terms of where we are today. As I said earlier, there was quite a bit of time spent on piloting and planning some of the initiatives for transformation. And then in 2015, we spent a lot of time on just designing those core elements of the types of tools that will be needed to be able to bring this transformation effort to a larger scale across the state, such as developing the common scorecard and such as developing the milestones for practice transformation, soliciting the vendors that would work with the providers in doing that. And in 2016, this is our big implementation year. This is the year where we are launching many of the initiatives that are jump-starting us on this journey toward transforming healthcare across the entire state. Peggy will talk to you a little bit about the launch of our 3 healthy neighborhoods. As I indicated, we're releasing the Common Scorecard statewide version 2 so that all providers can participate in this more than the initial ones that we had as part of the pilot. We have started enrolling providers into the practice transformation effort. Our goal for the end of 2016 was 50%. We're currently someplace between 30 and 35%. We are working with the payer community to start to monitor their launch of outcome-based payment models that we hope that by the end of 2017, every provider will be participating in some form of a value-based payment model. We are still, as I said, working toward bringing to scale the provision of care coordination within every practice across the state so that every person in Delaware who receives health care, that their provider is offering care through care coordination and integrated care, where they're working with all of your providers around whatever the healthcare issue may be to make sure that there is nothing that falls through the cracks for your care, to make sure that once you leave from outside of their office or outside of the hospital walls, that the care that you need within the community continues as well. And we're also beginning to implement a workforce strategy where we are rebuilding curriculums for health, for medical education. We're also building a consortium of support for medical education, and we're also building a curriculum for what we're calling learning and relearning, so that providers that are already out there, that they too will have the opportunity in terms of training and interdisciplinary professional training, where they are working with disciplines across all aspects of healthcare to be able to promote care coordination and the integration of care. So I will stop there and ask Peggy to come up to give you the second half, and then we'll be happy to answer any questions that you have.
Good afternoon. So why did we really start to drill down and have a second speaker for healthy neighborhoods? That was my question since I started 5 weeks ago. Okay. Julane has a little bit of a head start on me, but I've worked in Delaware for 25 years on community level work, starting with Boys and Girls Clubs 25 years ago. I see George Kropansky in the back, who allowed me the opportunity to start working in communities, and I'm very passionate about community level work. So I'm honored to be here, especially when I looked at what you talked about, serving humanity. And I'm going to give you one fact. When a patient goes into a care setting, that care setting only has up to 20% impact on that patient's overall wellness and care. The other 80% is determined by the environment, the community in which he or she lives in. So if we can only, I don't know if you're a betting person, but if you went to a racetrack and somebody said, why don't you bet on a horse, they only have a 20% chance of winning. Chances are that you would probably not bet on that horse. Well, there might be a few people at my table, I think, after today. So what is really important here is to understand that overall wellness is really based on the community. We know that a person's life expectancy can tell you about how long they'll live based on their zip code. And because of that, we know that we need to look at this as a holistic perspective. And we are looking at it from a collective way. We as a community have the power within our hands to form in ways that can make and change our environment so that people have a better chance of living a longer, healthier lifestyle. Our physicians cannot do this alone. When they write a prescription and someone walks out the door, if they don't have access to healthy food, they don't have access to a safe environment to exercise, they don't have access to getting to a nutrition class or to go to a class on diabetes, or they are homebound, they're not going to get well. And so we as a society need to say what is in our community that allows us to benefit them in a meaningful way and fill those gaps, provide those services, and be there in order to help them obtain what we all should have, the ability to thrive, grow, and live in the way we were meant to live in this life. So that's my opening statement for the first 5 weeks. We are really charged with looking at 4 areas that the State Health Improvement Plan, as well as the Healthy Neighborhoods, and as well as the Delaware Center for Health Innovation, did extensive research on what are the 4 areas in our catchment, in our state, that will really make an impact on the lives of people and on our wellness as a state. And the 4 areas, they're very broad, are healthy lifestyles. That could be anything from being able to be, from an obesity issue, to being able to be physically active, not smoking, so forth and so on. Maternal child health, babies born healthy, developmentally appropriate milestones. Mental health and addiction, we have a huge issue with that in our state right now, and every state does, we're not alone in that. And chronic disease prevention, okay? Chronic disease and prevention. And so DCHI is looking at this, and we're going to be forming healthy local community councils across the state. And there are going to be 10 state initiatives, councils that are formed, healthy neighborhoods, that are driven by the community, for the community, to meet the clinical care setting. So, you know, the community over here and the clinical care setting over here have to start communicating with one another so that we understand what the needs of the clinical community is and what the needs of the regular community are. And how do we embrace those two together in a meaningful way? How do we help support that clinical community and help keep people from going in to have services, as well as when they come out to get what they need in the community to meet them? And so these communities will form local councils, they'll come together, they'll put plans in place to identify what in those 4 categories they can work on, to align activities, to drive resources in a unified way, and to address one of the areas within their community that is affecting them, whether it's in the mental health, whether it's in maternal child health, whether it's in obesity, chronic disease, healthy lifestyles. They will identify their need, they will work together to address that need, and they will do it in concert with the clinical community. So, our vision is to design an integrative and collaborative local solutions to improve the health of residents, because we know every community has special areas of need, pockets of need, and if we don't address some of the social determinants of health, we will never be able to change the trajectory of health. So, we are also going to bring together strategic partners, but everyone's a strategic partner. Our table here would form a local council in the best of worlds. Local business, blood bank, healthcare, schools. How do we work together amongst our community members? How do we collectively align what we're doing together? Poverty. You know, it amazes me, I say, this is my, I have a statement for this year that's called "Complex Problems Take Complex, Not Linear Solutions." We try to use linear solutions, and that is not going to solve the problem of healthcare in our country. Healthy communities are complex issues, and we have to all work together in solving those problems. So we're going to integrate the health system and the community organizations. I talked about that. We have dedicated full-time staff to help with that. We're bringing them on now. We're going to provide communities with shared access to resources. That includes looking for outside resources outside of the state, additional funds to bring in, to get down into the local communities in some way to help them drive change in a meaningful way, and to be smarter about mining resources. A lot of times we see a lot of duplication. And so is there a way for us to be smarter about how we utilize those resources in real time to make a collective impact? And then what we're going to also do is make sure that we can maintain some of the infrastructure, because communities really struggle. We hear this all the time. I know that Sheila is in the audience from Dana, Delaware Alliance for Nonprofit Advancement, and we just believe that people will engage in purposeful collaboration, but we all get in our own lanes. It's really hard to unify, to unite each other when we're working so hard in our own organizations every day. There has to be a catalyst for that. And I know there's different organizations that will be driving that. I know Dana's working towards that. So also is the DCHI through our Healthy Neighborhoods Initiative. We have to have a coalescing force to create that collaboration in a purposeful way. And so that's part of what the Healthy Neighborhoods will do. So that's high level. In about another 6 months, I probably can give you some more detail after I've begun my journey more in depth. But it's been an honor to speak to you today, and if you have questions, Julane and I both would be glad to entertain them.